All right, today we're going to play medical detective. We're tackling a super common mystery, the case of the missing energy. It's this sneaky condition that affects millions, almost like a thief that quietly drains your vitality. So let's get this investigation started. You know that feeling, right? That bone-deep exhaustion. But what if that constant tiredness, the kind that coffee just can't fix, isn't just because you had a busy week? What if it's your body trying to tell you that something really, really important is missing? That feeling of fatigue. Well, that's our first clue.
So what's the name of our culprit? It's called Iron Deficiency Anemia. And honestly, how it works is pretty straightforward. It's like a domino effect. If you don't have enough iron, your body can't make enough hemoglobin. And hemoglobin is the super important protein in your red blood cells that, carries oxygen around. So less iron means less hemoglobin, which means your whole body is basically running on low oxygen.
Okay, so we've identified our suspect. Now it's time to gather the evidence. And your body, it's a fantastic witness. When it's low on iron, it starts sending out some very specific signals, telltale clues that'll help us crack this case wide open. The first clues are usually the most common ones, the usual suspects. We already talked about that crushing fatigue, but you might also notice something called pallor. Basically, your skin looks kind of pale. A good place to check is the inside of your lower eyelids. Or maybe you find yourself winded just from walking up a flight of stairs. These are those classic first alert warning signs. Now, this is where our investigation gets really interesting, because the clues can go from common to, well, downright bizarre. One of the most fascinating symptoms is a condition called pica, and that's an intense craving to eat things that are absolutely not food. We're talking dirt, paper, even clay. And get this, there's a very specific type of pica called Pagophagia, which is a total hallmark of iron deficiency. It's this weird, intense, overwhelming desire to chew ice. I know it sounds strange, but for a doctor, hearing about a patient who can't stop crunching on ice is a massive red flag that points directly to low iron. Here's another really specific physical clue. It has to do with your fingernails. It's called chylonychia, and it's where your nails get soft and actually start to curve upwards, kind of like a spoon. It's such a classic sign that it's a favorite on medical exams, and it just goes to show you how physically your body can react to this kind of deficiency. And the physical clues don't even stop there. Doctors will also look for something called glossitis, where your tongue kind of loses its normal texture and gets all smooth, swollen, and beefy red. And they'll check for cheilitis, which is when you get those painful little cracks and inflammation right at the corners of your mouth. All these physical clues are super compelling, right? But to really solve the case, we have to go to the lab. The definitive proof, the smoking gun, if you will, is found by decoding the results of a simple blood test. This is where everything becomes crystal clear. So before we even dive into the numbers, let's just picture what the lab techs are seeing under a microscope. A healthy red blood cell is a good size, it's plump, and it's got a nice, rich red color from all that hemoglobin. But with iron deficiency, the cells become microcytic, that's just a fancy word for too small, and hypochromic, which means pale. They're just not built to do their job right. So how does this actually look on your lab report? Well, your hemoglobin is going to be low, your serum iron, low, your MCV, which confirms the cells are small, is also low. But then you see this one number, the TIBC, total iron binding capacity, and it's high. And you might think, wait, why is that one high? Well, it actually makes perfect sense. Think of it like your body screaming for iron. It's putting out these help-wanted signs everywhere, ready to bind to any iron it can possibly find. It's a measure of how hungry your body is for iron. But of all the numbers on that report, this is the one. Serum ferritin. This is the big one. Think of it like the fuel gauge on your body's iron tank. The other tests tell you what's happening right now in the bloodstream. But a low ferritin level, that's the most sensitive sign that your actual reserves, your emergency stash of iron, are totally depleted. So we've gathered the clues, we've confirmed it with the lab work, we've cracked the case. So now what? Well, now we move on to the resolution. It's time to talk about the action plan for getting your body's essential iron reserves back where they need to be. For most people, treatment kicks off with simple oral iron supplements. But listen, how you take them makes a huge difference. For the best possible absorption, you want to take them on an empty stomach. And here's a pro tip. Take them with a glass of orange juice or some vitamin C. It seriously boosts how much iron your body can grab onto. And just as important is what to avoid. Things like milk, coffee, tea, and antacids are like roadblocks for iron absorption. It also really helps to know what to expect when you start taking them. Yeah, some people do get side effects like constipation or an upset stomach. And there's one thing that can be pretty alarming if you're not warned about it. Your stools will turn black. This is completely 100% normal. In fact, it's a good sign that your body's absorbing the iron. Oh, and a little practical tip. If you're on liquid iron, use a straw. It'll keep it from staining your teeth. Now, for some people, oral supplements just don't cut it, or their bodies can't absorb them well. In those cases, doctors might go for a more direct approach with intravenous or intramuscular iron. When it's given as a shot, there's actually a special technique called the Z-Track method that's used to lock the medicine deep in the muscle so it doesn't leak back and cause any skin staining. So treatment is one piece of the puzzle, but long-term success, that needs a solid action plan. This is all about understanding the root causes, making smart choices with your diet, and just knowing what the road to recovery really looks like. Your diet plays a huge role here, and you have to know that not all iron is created equal. There are basically two types. You've got heme iron, which you find in animal products like meat, poultry, and fish. Think of this as the VIP iron. Your body absorbs it super easily. Then you have non-heme iron, which comes from plants, spinach, lentils, fortified cereals. It's still good for you, but your body just has to work a little harder to absorb it. All right, let's wrap up with the absolute key takeaways. First, it's so important to figure out the root cause. In adults, the number one culprit is usually some kind of chronic blood loss. But in toddlers, a very common cause is something called milk anemia, which happens when they drink too much cow's milk and not enough iron-rich foods. And second, be patient. It takes about 4 to 6 weeks for your hemoglobin to start rising, but you'll likely stay on iron for several more months to fully rebuild those all-important ferritin stores. And with that, our case of the missing energy is closed. The mystery of iron deficiency, well, it's not so mysterious once you know what to look for. It's just a powerful reminder that our bodies are constantly talking to us, sending signals. Some are subtle, and some are just plain strange. The only question is, are you listening?